Okay, thanks. Thank you for coming. I prepared in anticipation that maybe one or two who might not necessarily be all familiar with what we are doing, but the goal here is to share our experiences with how we've approached training policymakers in Ghana. So, a lot of the uh, a lot of the evidence and all of the content of it will be largely coming from our work in Ghana, and then as we delve in and discuss and think through, we'll be able to add other aspects of it to it. So, our organization is called Center for Learning and Childhood Development, and we work in the early childhood development space, and have been doing quite a bit of training and engaging with policymakers. So, a lot of our examples are coming from that. So I want to talk about just just one or two slides on just a reminder of what our project is, and then training policymakers, and just a summary and a conclusion of what we are intent to accomplish. So our project has three main components. The first one is obviously research, which is looking at how do we study intersectoral coalitions and how does it function, particularly what are the processes and what are the systems and different topologies of it and the configurations of how does it work. And then the second part of it, to be able to study that, we are implementing a policy development process across five different sites in Ghana and Argentina. And we are creating plans and policies that are costed and validated by focusing at a subnational level. And then we are building the capacity of local governments and students and workers to pursue intersectoral action and intersectoral policy making. So when we think of intersectoral, for us, we are looking at the root systems of what really supports children to thrive, because it requires everyone to be on board, from the way we have data systems, from the way we deliver services, from the governance, from the financing pieces, and all the stakeholder engagement parts of the work that we are doing, and then obviously the human resource, which is where I'm going to focus a lot of my time and energy today. Okay. Whenever we're about to do training in Ghana, I have this, I envision this in my head, three things. And I think most of us have experienced this in one way or the other. First of all, you go to a class or you go to a training and you feel like you are not supposed to be there. The content there is like, is not what you were even expecting. Not even the content, like you're just not the right person to be in that particular room. And when it gets to that part, it means that maybe the audience and the content and the training, there's a mismatch of that. The other one is that, okay, I am the right person to be there, but you realize that in the course of the presentation, you either feel so lost or you are so confused. It's not that the content is not there, it's just like the delivery of it. So sometimes it can be a symptom of both the content and also the delivery. Or there are scenarios where you really enjoy the training, but when you are done, you don't necessarily know what are you to do with the information. Are you supposed to feel empowered? Are you supposed to go and do something, or is it just informational purposes? So sometimes I'll put presentations together and there's just too much content, and then the audience get really confused about what is the most important thing that do you want them to be able to get out of it. So that becomes perhaps an issue of action. What do you really want them to do? And so this is at the backdrop of how we are thinking about when we are going into train policymakers or people who work with us. These things are quite a bit at the forefront. So I want to divide the talk then into these three main areas. One is the audience, the content and delivery, and then how do we get them to do the things that we are hoping will transform children's lives. So similar to the framework that I created for our project, I think I also wanted to use the same three Venn diagram approach. It might not be the only approach, but the first one, I think if you don't get anything out of my training today or out of a talk today, is the first one is the audience, that it is so critical that you convene the right people. Because when you work with policymakers, sometimes you want directors to be present, but they sent in senior program members. So you will train the senior program members, but you actually want the directors to be the one doing the work. So there is a mismatch. So convening the right people. The other one is thinking a lot about the content and delivery. And today I'm going to give you three main ideas or concepts, one around framing, one around feeling, and then the other one around facilitation. And then you also have to think up through about what exactly do you want them to do. But here you're focusing a little bit on the anticipated barriers that they are going to face at the individual level, but also at the organizational level. What do you want them to do as an individual versus what do you want them to do as in the organizational perspective? So I'll introduce you to the immunity to change framework. The last part of it is obviously the environment, which is where we don't think the most about. So we've had a lot of training programs sink as a result of not thinking through what the enabling environment will look like. So I want to start with the environment because I think it's the basis of where we start from. The first part that's really dawned on me was when we were doing the early childhood development dashboard. We're bringing different ministries and agencies together. And the dashboard that we created was a very internet-based dashboard. You need good internet connection to be able to do that. If you live in a low and middle income country, you realize that sometimes internet can be an issue. And even here in high income countries, sometimes it can be an issue. But the venue that we chose was a venue where the internet wasn't necessarily great. And so when we got there, we realized that here is a really good tool that we'll be able to develop, but people were struggling to connect to it because at the time, the place that we chose for the training wasn't necessarily the best place. So when I'm thinking about an enabling environment, what do I mean by that? I'm thinking about who is going to facilitate. Sometimes it has to be someone who can speak the language or a combination of both. You have to think through, really carefully think through what the venue is. So we did one on unpaid care work. We wanted to do breakout sessions and we invited a lot of senior level people to come. When they came, they loved the training, they loved what we did. But the question they said was like, their issue is that there wasn't enough parking because these senior level people are always bringing their cars and stuff like that. And so that was a big thing for them. We're also thinking about the technology. But the last one I really want to push for all of us to think it through, I see also what we do is called scenario-based planning. And the scenario-based planning is thinking through what could go wrong. And oftentimes, when we are going to train, we are optimistic that things will work out for us. And so you go, you show up, you deliver, and then you leave. But we take a very deliberate approach. Okay, what if the person who is training doesn't show up? What if half of the participants don't show up? What if the PowerPoint doesn't work? What if the slides that we are doing doesn't? What if the technology doesn't work? So we literally go through one at a time, thinking about what is the worst case scenario for what, and in Ghana, what is the power goes out? That's another thing that we need to kind of think about. So we think about these processes and then we plan for all of those things and even the sequence of when things appear and when things doesn't go appear. When we started thinking about scenario-based planning, my team, they were like, why do you have to always be so pessimistic? But I think over time, Leonie and Matilda and our team will tell you that one of the best assets that we have for training is to thinking about what can go wrong. Now I want to talk about the audience. There is a book that we've been reading. It's called Good to Great, From Good to Great. And it's a New York best time seller, written quite a bit ago, around 2007 or 2008, by Jim Collins. And he looks at what makes good companies become great companies. And the core thing he talks about is that you need the right people in the bus and the wrong people out of the bus. Because he says that if you have the right people in the bus, even when things are going wrong, they're able to be able to help you move into the right direction. So sometimes when we are going to do training, we don't think about who are the right people who needs to be in the room for us to train them. So for us, we use principle of authority as part of persuasive communication, where the letters that we are sending is not necessarily coming from our organization per se, but it's coming from the municipal, it's coming from the government, we're coming from very highly credible organizations in, that will represent that sense of authority. We also factor in different kinds of incentives to get the right people into that specific room. Sometimes it doesn't really work. But if it doesn't work, I know what I can control is that I can control and understand. Um, I need to really know who is going to be in the room. Is it all people who are already experts? Is it a mixture of people? Are there caregivers? Are there no caregivers? So our last training that we did, we were in our mind, we were thinking these are NGOs, these are government leaders, but almost one third of the population that were there were caregivers. And the presentation we created and everything was geared towards the policymakers without necessarily thinking about the caregivers, and that created a big of a problem. So we had to kind of go back between the language stuff. So what about content and delivery? So for content and delivery, I'm going to talk about issues around framing, feeling, facilitation, and stuff. But first, let me walk you through a bit of the content. When we are thinking about content, we are thinking about frameworks or theory-driven approaches. So what when we pinpoint a theory or a conceptual framework, it helps us a lot because it allows us to be able to then hang the content around. So if you think about all the trainings that you do, whether you are making it explicit or implicit, there is some way that you organize it in your mind. And I think if you make it quite explicit for you, it helps you to decide what content each of the different individuals need. So for intersectorial one, I know there are multiple frameworks, but W2 has this framework for multi-sectorial action, and we use it in our grant a little bit, and it has four major elements. It's a very complex one. This is how it looks like, but these are the core elements of it. Say governance, so what the policy and the vision looks like, what the stakeholder voice, who are you engaging, the information intelligence, the rules and the legislation that goes around with the governance systems. And then you think about financing. How do they go about raising money? How do they pool resources? How do they do purchasing? But also, what is the governance structure for the financing? And then you have resource generation. So the workforce as a resource, the infrastructure and equipment that are needed, all the supplies and the consumables that are needed to deliver the services. And here too, you have to also think about the governance system. And then here, service delivery, because they're looking at health, but here will be like early childhood development services, and then the different layers of what that looks like, but also what the governance structure for that looks like. And so when we have a framework like this, when I'm then going to the train, then I'm looking about, okay, what other things can I talk about? Vision, how do we do stakeholder engagement? And so that it allows the participant to see such a cohesive approach to how we do the training and the content. So if you're interested in the model, I didn't want to spend too much time on this one because it's a bit busy as a slide, but those are the different elements of that. So what are the contents that for our epic project? What are some of the things that maybe we should be thinking about? What I showed you is the framework pieces, but obviously system thinking is the new paradigm in the way that we approach multi-sectorial action, thinking it through that way. But our project also focuses on nurturing care, particularly when you're thinking through responsive caregiving and all the different domains of it. When we talk about early childhood development, I know oftentimes we are talking about the benefits. Is it to the subnational, the national level that if you invest this amount of money, it gives you the most returns? But when we go, we frame it quite differently. What we tell them is when you want to attract people into your district or municipality, oftentimes in Ghana, they don't want to come if the school system is not good, if the health system is not good, if the things for children are not good, they don't want to come. So by investing in early childhood development, that is one way you attract the talent to the place. So and usually it resonates a little bit with them. And obviously, Sarah has been walking us through political economy. So if you're new to this, if you listen to our old recordings and trainings, you'll be able to see this. And then stakeholder voice, so the community engagement approaches, the child participation, and obviously monitoring and evaluation. So these are kind of the topics that we are likely to go through when we pitch it to them. But when we think it through, you will see that we will put them under the different intersectorial functions and sub-functions there. Thank you. Okay, now let's focus on the delivery. This I think I learned from Sarah the most. And I was thinking about the pedagogy. So framing, feeling, and facilitation. I was looking for three F's so that you'd be able to think it through. I think we don't spend enough time thinking about when you look at your audience, how are you going to position or present the information in such a way that it resonates with them? And that's what I think about framing. Like, how do you look at how they process information and how they think, and how do you position your work in that regard? And then the other one is a feeling. Um, I think we forget that policymakers are also have feelings. They're not only looking at just logic and stuff like that, but they're also looking at being engaged by having fun during the training. And then obviously the facilitation. So I'll walk you through different examples of how we've done this. So framing the issue. When we are framing the issue, I think we look at marketing theory, because we feel that the projects and ideas that we are persuading or we are presenting is almost we are salespeople. And oftentimes, scholars and academics, we focus heavily on what is the burden of the problem. This many children are dying, and there's many children are not reaching their developmental potential. And so you need to care about that. And that is really, really important, though. And we also spend a lot of time on the features of the project. So a lot of the time is about we want people to really know what the project is about. And I think that's also really essential. But what marketing people will say that people don't really care about you, the individual person who is delivering. They don't necessarily care too much about the project itself. They don't necessarily even care too much about the organization who's delivering it. But they really care about what the benefit of it will be to them. What kind of change are they going to see? What kind of improvement, or in some, what kind of transformation are they going to get? So marketing people will say, if you're trying to get someone to come to Argentina, you don't talk necessarily about all the, oh, you take this flight and you get to fly, you fly to the UK first and then you do your transition. You go, like, you spend so much time on the itinerary instead of spending so much time about how beautiful Argentina is, how wonderful Raul and his team is. Like when you go there, what the food will look like. Instead of you see Raul, he's even smiling. It's because like naturally we gravitate towards those things. So when you make those things more tangible to them, it really helps them quite a bit. So think through what those benefit frameworks will look like. So this is where the Sarah learning comes from. Whenever I work with Sarah, she's always doing timelines. And Sarah, forgive me, at first I didn't fully really understand why you were a bit, I would say, I use the word obsessed with timelines. Until we started working with policymakers, and I realized how powerful that looks like. Because there is a concept that is in your mind that I'm calling historical framing. They need to really understand how the project fits into their current policy paradigms and what they are trying to do. So here is the pitch. When we do the global steering committee, I started with neonatal mortality is declining, child development is becoming issues of delays and disability is becoming a problem, and we need to really pay attention because more children are not meeting their developmental milestones. Nurturing care is a really good framework, but it requires us to do a multi-sectorial approach. And then to a global steering committee, that makes sense. The burden makes sense, the significance makes sense, the solution makes sense. So when we did our national launch for our program, I went and did the same pitch because it did quite well when we did a global steering committee. When I was done, the first question was like, or the first comment was like, you didn't give us any background. You didn't tell us anything. And I was like, what do you mean by I didn't tell you anything? I told you about all the burden. I told you how important this is. I told you about nurturing care. But this is what they were actually looking for. They were looking for the historical framing of this project. Like when I went to the National Steering Committee, I didn't really pitch it through the lens of burden and significance. I pitched it through the lens of historical framing. So I started in 2019, Ghana, we did an evaluation report, and these were the problems that we did. And it said that multi-sectorial action is waning. So all the different sectors are doing their own thing. And then Children in All policy came and said we need to rekindle the multi-sectorial approach. And then that led us to creating a multi-sectorial approach to how we do early childhood development. But we realized that at the end of the day, even when we implement, the problem that we face is implementation and tracking. So we decided to create a dashboard so that we can track the policy better. And now the policy is approved. The fact that the policy is approved, it doesn't necessarily mean it will also work. You need to be able to bring the different sectors together so that we can work together. And so this is where we are. This is where the EPIC framework comes in, or the EPIC project comes in. When I was done with this, nobody came and told me you didn't give us enough background because I was able to situate our current project in all the policy developments that they've had, in where they are trying to go, and how this project is helping them transform or get to where they are going. And Sarah, I can't thank you enough. The last one is document review, trying to understand what their own strategic plans are, what their own activities are, and seeing how our project aligns with them or do not align with them, and what the gaps are. So that oftentimes stimulate the most conversation when we use or create local level data as a way of discussion for mapping different issues. The last one is I won't say the last one. The other one is the feeling piece. And I use the word feelings because when you sit at a place, sometimes some speakers are really funny. Sometimes they are just, they have a lot of charisma. Sometimes they're just so engaging. And you realize that a lot of it is not even the content, it's the way they're delivering it. And so when we go, we also think about, okay, how do we get them excited? So over time, we realized that we need to add a play-based learning approach to policymakers. So every stakeholder engagement that we have, for example, we have some fun games that sometimes have nothing to do with what we're doing, but for them to feel happy, for them to feel excited. So we do some rapid fires and competitions. And so here is one example of that. So this will be one example. So you could see them cheering her on, you could see them happy, you could see them and so particularly when we want to have a break, we do a lot of these things. When we don't do this, they will say the training was so boring or they're so dull, and so because we didn't have any of those elements in them. The second one is videos and images. We use that quite a bit. So here is we going to speak to policymakers, trying to think about helping them craft a policy that will address unpaid care work. And we thought about, okay, how do we get them to think about this issue? We wanted them to empathize. We wanted them to be in the shoes of caregivers. And so we decided to create a video on what is it like for a relatively poor mother with a child with disability. How does that look like? But we wanted them to feel sad a bit. We wanted to conjure that emotion. So here is an example.
John Gladys, Komla, Ingile Dennis, Yaira Komla. Only honey Nake, Ingile Serapos Gileji, Beken na 4 months, one more. She may na 4 months, 5 months, 6 months, one more. Ni Agbenemba, you are saying, Equadomo, no Juba. Ni Quebeco Memu, if it's Steve. Na Agbene na ke Gomo to ibele tomo nonika afobi we fi o won ya aso shije dane ke bini isi tabile yeshia no ya shike be ni ba pela ni be inya hikuma to ku gardens ke ni bi pele chenye ma kina kan fi ono no ku kumeto ndemo ihani ndun fa wa ni ke wa ke nka ke ndwen le be mi ma de ibana Jankane feel like I'm Babi wa ke we are wokumino. Achena babi ushi. Mukoko he je muku hisani. Somo koni yo mi emelde. Deke, yes, somo fe lo, she me ko melde. She no hu, ame fun ame no ake o. Me ke nye mi ne, na o ne ni yo mi ne ke. Mene ba ga te fitis, so la ga hende, mene ba ga te. Hende is kunya hi me ka hi. Ni he ko ni ka hi pi o ta. No ko to na ka. Ya.
So I'm Richard, and Yara is my cousin, 24/7. Her mom does everything. There's, she's not working and she can't move. So every time, even to the loo or to pee, her mom has to help her. And sometimes leaving her alone in the house isn't so appropriate.
Ìyàwó lẹ̀ ń ju èyí ẹ̀ ń ju ìgbé náà kẹ̀kẹ́ fi tiyan lẹ̀ kẹ̀kẹ́ lù ẹ̀ lù tí ẹ̀gbé náà kẹ̀kẹ́ ẹlẹ́fẹ́ wọ́ta ṣe fi o ẹ̀ hàn ọmọ yẹn lẹ̀ kẹ̀kẹ́ àwọn ní ní halẹ̀ kún kẹ̀kẹ́ halẹ̀ ní ní èyí ẹ̀ yẹ ní ẹ̀gbé náà ẹ̀dá ọbẹ̀ hẹ́kùyà ìkẹlẹ̀ ẹ̀yìn ọ̀fẹ́ fún òní náà wọ̀ta ìyẹn tv wọ̀kú ọ̀ṣì tv wọ́n bá fi dé wọ́ta àtúnyẹ̀ ayọ̀rẹ̀hó náà. Yàrá ẹ̀rọ̀gà. Ẹ̀pẹ́ mọ̀ ìjínú kò ní kàn ṣe ẹja kẹ ìbẹ̀ mọ̀ kò ní wà ní yàrá pẹ́ mọ̀ wọ́n hàn ní inú fíànù ẹ̀bà ṣe. Ìyẹn ẹ̀ kò wọ́n máa yà ṣìkásá ní ní yẹlé mi. Ìyọ ní 3 times a day. Ìyọ̀n gbẹ́lẹ̀ ṣìká ní máa fi tiẹ̀ fi pẹ́ntẹ́ mi. Ẹja kẹ báyìí pampers kẹ níbi ìtàlẹ̀ wò mí. Ìbẹ̀ mọ̀ kò ní wà mí. Ìwé hàn ní inú fíànù ẹ̀ fi bàṣà. De kume kwa sani macha mukume ye fun no ake wo mene ni ntawo shika neke ngbe shika efi ni je da na hu ni macha mukuni ake wa mi ni ju ehi nfo eni bi ahi de kume ni han le ni be pele te yu fridge po ni ke wo ma wo ni ma fi wo ni ka wo ni ibanye iwa mi hu e fridge mu efiti ni je ake nílẹ̀ kò mẹ́tò pẹ́ jí ń bí ní fún ọ ní alẹ́ náà ń bàdàn ṣe é wẹ́ náà wà pẹ́. Lóní ṣiṣi jẹ́ àmẹ́pẹ́ náà mẹ́hìn agbẹ̀rẹ̀ lè bá bọ́ ìṣúná fi hàn àmẹ́kẹ́ má jí ilẹ̀ jẹ́ mẹ́ṣí fọ́ọ̀lù ẹ̀kẹ́ because of ní bílẹ̀ ìwọ̀ àmẹ́nyà àmẹ́kà àmẹ́bí àbàṣù ìwọ̀ máa wù lẹ̀kẹ́ yà ní hàn ní ìpasù kàbàtàbí àlẹ́ yà sùkú lọ́wọ́ dáhùn ẹ̀ ṣe.
Anyway, that's that. So we use videos a ton as a way of capturing different issues and highlighting different problems that we are trying to address. Then the third one, so I talked about the framing, particularly using historical framing as an important tool, talked about the feeling, using the both the games and images and stuff like that and the videos, and then facilitating the learning. And oftentimes, the panel discussions is a very a common one, and group-based activities are common ones. But we also realizing that it works so well for them for analogies and case studies, particularly when we have to go in. We'll do a quick qualitative literature research around. So, for example, if you're doing disability, and I was doing one in Pakistan, among Pakistani stakeholders and policymakers, it's like looking at published literature around qualitative and the stories around disability. And then we use that to create the cases. And so they're able to kind of resonate with us. But the other one, powerful one for adults, I think, is analogies. And I want to show you some example of that. So, Ghana, when you come to Ghana, most of our foods are has a tomato, onions, ginger as a base. So this is the one of the most simplest foods called tomato stew, for example. Um, and Ghanaians have a very particular way that they do it. And so I wanted to use cooking food to teach them about logic frameworks or monitoring and evaluation as part of our dashboard when we're working on that one. So I was okay, they understand cooking. So I said, well, if you want to make a Ghanaian stew, first of all, you go to the market, you buy your stuff or go to the farm or whatever it is. You have a place that you need to cook. You need money to buy the things that you need to buy. You have to buy all the ingredients, particularly your tomatoes and your oil. Those are really critical things. And then you need a pan, like you need fuel, you need all those things. And then you also need the person who's going to cook or the recipe or the steps that you're going to follow through. Then I'll tell them that in monitoring evaluation, we call them inputs, the things that you need before you even start. And then we go about the process. What is the process? So think of the activities when you're cooking. At the very least, you need to heat the pan. You need to add the oil to it. You need to add the tomato stuff and you need to stir it to cook. And so then I'll use that to say, okay, this is what we think about process, the activities or the strategies that you're doing. And then I'll talk about output because sometimes the output and the outcomes are very confusing. And I'll say, well, before you actually get the stew that is being made, obviously you want your meat, if you're using meat, to be very well marinated. That's rightly after what you've done. You need to cook the tomatoes and make sure that the vegetables and everything is cooked. And then all the spices you need to add to it, you've already added them. Your goal, though, is to make a stew. When you have done the goal, you already have your stew, but the fact that you've reached a goal doesn't necessarily mean you've made an impact. And here the impact is that you can make the stew, but the stew is not edible. It tastes so bad, or the stew is in such a way that it is not delicious and it will make you sick. So that is also a problem. So I'll use that to explain that is the outcome, and for example, that's an impact. And so we walk them through those processes. Now, intersectorial one, that's can be hard to kind of explain sometimes. But the way we've been going about it, at least the way I've been explaining to my mother, that seems to make sense to her, is we think of when there is a serious crime or serious stuff. In Ghana, typically the military and the police will come together to form a joint task force. When you form the joint task force, here's the thing that I tell them. Don't you need, when you bring the police and the military, don't you need someone to oversee it, whether it's a committee or a commander? So wouldn't that be your governance structures that you need to have in place? If you don't have it, where are they going? And then the human resource. What if the criminals are better fighters than the police? Or the military. That's a problem. Or the resource or the guns and the things that you need. That's your human resource. And then I also say, won't you need to gather information about what the criminals are doing and how they're doing stuff like that? Yes, obviously they agree with that, and that's your information system. And then the stakeholders, what if the police and the military gets into the community and they get ticked off all the time? That becomes a problem. So stakeholder engagement. So we go through that, and then the actual operation and the finance and things like that. So we use that as a model for helping do that. The last one is the action. I'll go through a bit quickly so that I don't take all the time. When we are thinking about the actions here, I'm talking about the behavior that you want them to practice or the understanding that you want them to gain. And oftentimes, as academics, I think we are very good at creating competencies that we want them to develop these specific competencies and these skills. And then we develop really good metrics for tracking progress. And I think those are all good. And that we incorporate that quite a bit into what we do. But oftentimes, we don't spend enough time thinking about what is the barrier to action. Like after you've told them all these things that you want them to do, what are the things that you anticipate they're going to face that will make what you have taught them a little bit harder for them to be able to practice? So we think about it from an individual level, but also from an organizational level. And I want to talk about two different behavioral theories that really help us. One is called the Fox behavioral model, and then one is called immunity to change. Um, the Fox model, it's quite simplistic, and I think that's the reason why perhaps our team likes it so much. Is I says you need three main ingredients at the individual. It's very simplistic, obviously. One is that the motivation, the hopes and fears, and the pleasures or pain, or the social acceptance or rejection. So, what is motivating them? How can you motivate them to do the practice? Do they have the ability in of itself, the self-efficacy, for example, in our project, the knowledge and self-efficacy? So, do they have the time, the money, and the effort to be able to do that? And then the prompt. What are the things that really are the cues to action to get them to be able to do that? So, whether it's a spark or a signal, a facilitator, however way. So sometimes we'll create champions as reminders. And then obviously this is a graph of that. So we want high motivation and high ability, and we want to create a prompt for them to be able to uh, get the behaviors and things done. The last one is what we call immunity to change. And the analogy here is our immune system are really good at helping us fight diseases and making us healthy in some way. But sometimes the immune system works too well and it starts making you sick, like Crohn's disease and IBD, inflammatory diseases, where sometimes they are triggered by your own immune system attacking it at your own body, and that makes you sick. And the premise of immunity to change is that even though we have a commitment to change a specific behavior, there are certain things that we are doing and not doing that is our commitment, and it ends up turning against us. And so for you to be able to change, you need to be able to understand what the immunity is, and that's a very system way of thinking. And to do this exercise, we use what we call an X-ray, and it comes with that particular book. The first section is, what are you committed to? What is the goal? What is the behavior? Is the understanding? Is it a goal that you want to really achieve? And then what is it that you are doing or not doing in order to meet this that is preventing you from achieving this goal? And then what are you, in some way, what are your competing commitments? What are you worried about? Why are you doing these things instead of this thing? And you say, I'm worried because if I do this. And then the last one is the assumptions that you have relating to this one. So here is an example. Make it concrete. So think of Raul is always my target example, which is Raul says he's very committed to delegating tasks and open to other ways that people do things. That is the goal that Raul has. But if you look at it, you realize that maybe Raul is doing everything himself. So even though this is the goal that Raul wants to achieve, he's saying he's most of the time he's doing things by himself. And you ask him, so why are you doing this by yourself all the time? Well, then Raul says, well, if I don't do it, I think we will fail. Or Raul will say, I feel like I need to be able to have control over everything. Then I ask Raul, so why do you feel you need to have control over everything? Then Raul will say, well, I assume that when I am the one in charge, I'm able to come up with the best solution. So that is the assumption. And then the immunity chain will say, then test the assumption. Is it really true that whenever you are in charge, you come up with the best solution? And sometimes this may not be true. Maybe sometimes when Pablo is in charge, maybe when sometimes Fabian is in charge, different solutions come out. So you realize that the assumption that they are working with. So we think through that. So when we're doing, say, child participation, we know that they will say they assume that children and adults cannot make the same level of decisions, and children's decisions are usually childish. And so then, because we know that, we'll create a video about asking adults and children the same question and then seeing how, and then we'll demonstrate to them that, you see, what the children are thinking are not too far off from what the adults are thinking, as a way of persuading them to do that. So in conclusion, what am I saying? What am I pushing towards helping you to understand? First of all, start with the enabling environment. Make sure the facilitation, the venue, the technology, you've already gone through the scenarios to make it really well. And then the second one is think about your audience. Make sure you're convening the right people. If you don't have the power to convene them, make sure that you know what the composition of those individuals are. And then you have to think about your content and your delivery. And I've given you different ideas, particularly the 3 Fs, how you're going to frame it, think it through, how you're going to make them feel, and then how you're going to facilitate, particularly using analogies and case studies, and then bringing in some of the behavior theories and organizational theories to think about what actions you want them to kind of take. Okay. All right. These are the resources that you may have. All right. Thank you. Sorry, I'm done. I hope I didn't go too far.
Congrats, Kwame. That was really, really interesting. And it's really obvious that you've put a lot of thinking into this over many years. And I think we're lucky to benefit from that on this this webinar. So thank you so much for sharing. I'm not sure if I'm chairing, but Fabian has a question or a comment. So let's go to him. Over to you, Fabian.
Gracias, Sara. Disculpe por hablar en español. Felicitaciones. Me tengo que ir en 10 minutos, por eso me atreví a pedir la palabra primero. Varias reflexiones de todo lo que nos planteó el colega. Uno es recuperar la idea de un enfoque más que pedagógico, yo diría andragógico, porque estamos trabajando con capacitación de adultos. Yo suelo hacer cuando capacito a funcionarios un ejercicio que es preguntar a los colegas que están en sala cuántos años de experiencia tienen en la gestión social, la gestión pública. Y a veces tienen 10 años de promedio, entonces si uno tiene 30 personas en la sala, tiene 300 años de experiencia. Con lo cual, el rol del capacitador es aprovechar esos 300 años de experiencia. Eso sería el primer aspecto, yo diría, de carácter andragógico. Lo segundo, definitivamente, es el tema de la audiencia. Yo creo que el gran desafío en intersectorialidad es cómo combinar estrategias de capacitación virtuosa entre funcionarios de alto nivel político y equipos técnicos, porque definitivamente el excelente trabajo que uno puede hacer a nivel técnico, si no genera sensibilidad en los actores políticos, el esfuerzo técnico se queda a mitad de camino. Creo que ahí hay otro elemento, por lo menos por mi experiencia de haber capacitado más de 10.000 funcionarios públicos en mi vida. El tercero tiene que ver con los contenidos. Creo que efectivamente en función de los perfiles de las audiencias hay que definir cuál es el punto de equilibrio entre contenidos más estratégicos, por ejemplo, para los decisores de política pública, y contenidos más instrumentales para los equipos más técnicos y operativos que tienen que ver con la intersectorialidad. Y en ese sentido, dos mensajes fundamentales que a mí me parecen centrales en este debate. Uno es no perder de vista de que para que haya buena intersectorialidad tiene que haber buena sectorialidad. Uno en general trabaja con técnicos de salud, de educación, de vivienda. Bueno, es claro de que si no hay una buena gestión de cada uno de esos niveles sectoriales, la intersectorialidad no emerge, no sucede. Y el segundo mensaje, y con esto termino porque hay varios colegas pidiendo la palabra, es no perder de vista que en materia de intersectorialidad, más que crear la estructura que fomente intersectorialidad, hay que crear condiciones para que se ejerza la función de la intersectorialidad. Me parece que ese es un elemento también de contenidos que en general cuando yo trabajo estos temas me gusta dejar planteado. Perdón por extenderme, muchas gracias.
Thank you, Fabian. I texted Carlos. I don't know, Carlos, if you saw my message asking if you could summarize and translate because no, you didn't see it because Fabian's question had 3 parts and it was not translated on my screen. I'm sorry. I thought we had figured that out, but I guess we haven't. I think Kwame had the same issue. I'm very sorry. Is there someone, Carlos, I don't know if you were able to catch that, or Raul, it was a long comment.
Yeah, so
Well,
sorry. It was a very long comment and I couldn't follow it all, so sorry.
Well, I can make some comments. First, he recognized the effort and the contribution that Kwame has made in terms of the rich comments that you have provided, and what briefly what Fabian tried is to bring us is based on his experience training more than 10,000 policymakers in his life. So in this sense, he recognized that the value of recognizing the experience that he has to deal with when he confronts with the audience. And he mentioned just an example that if there are 30 people with 10 years of experience working in their own field, it means that there are 300 years of experience in the audience. So this is a capital you have to recognize when you work with people, in terms of just not thinking that the life starts when you come, that the value of the history that has been mentioned in terms of the information, existing information, of the timelines, the obsessive timelines. Okay, we are going to become also obsessive with the timelines. We also agree with this idea of valuing the history, and this is something that we permanently discuss in our group. Recordame, Fabián, alguna puntita, una palabra que oriente para retomar, porque no me cuesta capturar todo.
Respecto a cuál aspecto, al contenido o a la audiencia.
Yes, the other issue that he highlighted, it has to do with the contents, and this is extremely important to define strategically which are the contents that you are going to consider for any training activity. ¿Algún otro comentario, Fabián?
No, it's okay.
The importance of each sector in order to build a productive and effective intersectoral work.
Esto se ha transformado en un grupo de autoayuda. This is become a self-help group among us, just to capture all the people. I think that Anthony and Carlos raised their hands, please.
Thanks, Fabian, though. Thank you so much for the comments.
Just very quickly, first, I loved your talk, Kwame, and I particularly brought home to me the power of video. Because video and people telling their stories is so much more powerful than stats. And that woman's story was compelling, and it brought home, my goodness, how she coping and all the rest of it. So, and I think, I mean, that was a more detailed story, but I think short video, 2 minutes or something, getting a message across to policymakers is really important. The only other thing I wanted to ask was, at the end, you had some nice references to the fog behavioral. There were about 3 references, and I didn't have time to copy them. So I just wondered, you could put the slide up again, or, and I'll take a quick snap, or you could put it in the chat, whichever.
I'll put it in the chat. I'll put it in the chat for you.
Thank you.
Put it in the chat for you. Yes.
Carlos? Kwame, this presentation was amazing, and I'm sorry, I'm going to try to push a little bit against it, not because I don't like it, just because I want to take it a bit further. So one of the things that I find very problematic sometimes in a lot of pedagogical environment, but also within the whole spectrum of policymaking, is that we tend to have a very strong disconnections between the people doing the work and the people deciding what work needs to be done and the way it needs to be done, etc. So we are always having a kind of like a top-down affair, or kind of like a top-down approach between what the experts, and then again, this is a very loose term that, especially since COVID, everyone invest themselves into experts, and that the experts put that this is how it should be done. And then our training needs to be done so that the people at the bottom understand the truth. And then, and I find that it doesn't matter how much pedagogical methods one use. If that disconnection is there is no way of overcoming it. In the sense that most of the times, people who have never really been, for instance, frontline worker, are deciding what frontline workers should be doing.
Exactly.
And have very little understanding of the realities, of the very simple realities of frontline working, and yet are defining and, you know, creating case studies and doing all of these things to try to affect change. So for me, the challenge that I always find here is why we do not include within our pedagogical structures always the system through which the information is bottom up. So a case study, for instance, has that element, but it's ultimately, for instance, in the video, is curated from the top down.
Right.
It's never coming up from the bottom up. That is saying, look, this is what we're facing every day, and these are the changes that we require. And therefore, the voice goes from the frontline workers to the policymakers. So I'm just wondering in this kind of case, and I'm pinging on myself. One of the comments that Fabio did, when we're looking in intersectoral, sometimes we don't even have clarity in one sector, and we are already moving into, like, you know, working at a much even higher level. How we are to overcome this, and this is not just a technical question. I think it is also an ideological position.
Over. I think that's where I think before I got to the pedagogy, I was talking about the right people in the room. Because we realize that that's also a very powerful way. So for example, when we're doing the unpaid care work, what completely changed the way that we're doing it. I remember we're trying to, you know, brainstorm and figure out, and the policymaker comes out, it's like, we need to do mainstreaming, we need to do inclusive, blah, 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 blah. And then one of the mothers comes to me and said, no, we don't need that. We just need wheelchairs. We just need wheel and so Carlos, I think that's what you're trying to allude to. And it's because if the mothers weren't at that policy event, I think what the product would have come out would have been completely different. And then when we also had a panel discussion, initially we are just going to have, you know, the policymakers think through all the, and then we had the mother come and sit as part of the, and it was the most contentious policy event that we've ever had, because the caregiver was telling them what exactly it looks like, going through the whole system and all the rejections that she was going through and stuff like that. So I really agree with you on that level in terms of yes.
I'm very sorry.
I was gonna do a translation, Sarah. I didn't want to interrupt.
Okay.
Yes, okay. We're having a translation issue. So can you stop after each thought and Carlos will translate?
Carlos will translate. Okay.
Sorry about that. I'm sorry.
No, that's fine.
So what I want to say is Carlos is always right. Carlos is always right. And Carlos says that sometimes or most times we do the training plan from the top to the bottom, and then but it is often important to have the ground up too. And I was saying in our example in Ghana, we were doing disability work and we're trying to get policymakers to come up with solutions of how to address policy unpaid care work, mothers not getting payment for taking care of kids with cerebral palsy. And they were thinking about these big terms of we need to make sure that it is aligned with everything the government is doing. We need to make sure that it's inclusive in this. And I was telling the story that the mother came to me and said, no, we don't need any of that. We just need wheelchairs, you know. And so the experiences of those who are the beneficiaries of the policy are very, very different from the policymakers who are deciding for them. And so that's why I was saying that before you start the training, it is really important to have the right people in the room. Because when you have the right people in the room, and it's not just only policymakers, then the conversation changes. Then you're able to bring in the bottom up and then create that middle ground for that. So that would be one way to address that.
Ok, salto aquí un poco con una traducción muy resumida. Gabriela, una disculpa por lo del aventarnos unos comentarios muy largos. Mi pregunta era principalmente de que muchas veces existen, llamémoslo así, estamos como disjointed, no me viene la palabra en español, estamos como fragmentados. La mayoría de los sistemas están fragmentados y por ende muchas veces la distancia entre las personas que toman decisiones y las personas que tienen que lidiar o tener que enfrentar las decisiones que se toman, todo el camino está muy fragmentado, realmente las realidades no se conocen. Y creía yo o creo yo que no existe un sistema pedagógico que vaya de alguna manera a solventar esta fragmentación sin tener que incluir a la gente que está a cargo básicamente a desarrollar o entregar los servicios. Entonces, le comentaba a Kwame que siento mucho que muchos de estos sistemas fragmentados normalmente son de arriba abajo y la información de lo que se requiere o lo que se necesita nunca viene de abajo hacia arriba. Entonces, Kwame menciona que él está de acuerdo con esto, que esto es algo en el que él enfatiza la idea de que cuando estás haciendo un entrenamiento tienes que tener a las personas correctas dentro del sistema dentro de la actividad de entrenamiento. Y cuando se refiere a las personas correctas, no solamente significa quiénes son las personas que tienen el poder para llevar a cabo las actividades, sino también aquellas personas que tienen conocimiento, ¿no? Entonces, él pone un caso en el cual hubo un entrenamiento en el cual las personas, los policymakers, la gente que está dedicada a hacer política, ya estaban utilizando todos los comentarios de que tiene que ser inclusivo, tiene que tener toda la sostenibilidad, etcétera, etcétera, las típicas palabras claves que todo el mundo utiliza. Y la gente que estaba atendiendo el entrenamiento diciendo, no, ¿sabes qué? Todo eso no lo necesitamos. Lo que necesitamos para poder llevar a cabo ese entrenamiento son sillas de ruedas. Y que ese comentario tan sencillo, pero que venía de abajo para arriba, cambió muchísimo el entrenamiento que se llevó a cabo y que realmente vio un cambio de un entrenamiento que se fallido a un entrenamiento positivo o exitoso. Entonces, Kwame sugiere que tengamos siempre mucho cuidado con quién participa dentro de esos entrenamientos. No sé si me faltó algo, Pablo, Raúl, Hugo.
No, está muy bien, Carlos.
Carlos is always right.
No, yo tengo, primero, la gente de habla hispana está recibiendo la traducción. ¿Anda, funciona el sistema o no?
Sí, Raúl, perfecto.
Ah, bueno. No, I was asking if the translation is working or not. I will not take too much time, Kwame.
Yeah.
Just is a rapid reaction to your comments. First of all, I think that what you have presented is a lot of information. And perhaps this is my personal comment, but I would like to discuss with our group in the sense that we will need time to digest all the information that you have shared, because there's too much information. You have presented different kind of frameworks that perhaps they are useful for us, but in my case, this was the first time I became in contact with this. But this is also a way to start to discuss what are the commonalities in terms of the frameworks that you are using and what we are proposing, with a sense of something that we discussed at the very beginning of this project in terms of harmonization. Perhaps we have different venues, different ways to reach a goal, but the goal is the same. It doesn't matter that you highlighted the issue of disability, because it is the interest of your institution and what you are investing time, but for the case is the same. We can consider child disability or child development or child health or child well-being. The point is how we integrate all these ideas in terms of bring all the resources of all the capacities and all the sectors to reach this goal.
Yeah.
I have also some question regarding the issue of marketing. I agree with you that part of our work has to do with how do we market this idea and provide arguments to the policymakers. And that was the reason why we negotiated with the 5 municipalities, and the head of the municipalities accepted this because they consider this as a key issue. So we have a good point of departure. The question has to do with how do we build an enabling environment to facilitate this work to for the next 5 coming years. So it's a question. So now I think that the good part of this stage of the process is how to rethink together, how to dream together, how to build together in terms of creating these enabling environments. I think that most of our role will be to be enablers. I have no answer to your question if the right people are in the right room in the right moment, because this is, if you ask me how to know if they are the right people, perhaps my idea is that these people are going to be the right in terms of the results of their work, but not to define at the very beginning if they are the right people or not. This is just a question. It's something to discuss on how to consider who are the right people. And again, I think that we will need time to process all the information. I think it's very rich, very and very intense in terms of the amount of information that you have provided. But from the motivational point of view, I think that it was a very, very great experience. And you mentioned also that policymakers have feelings.
Yeah.
Okay, so we have to think about this question on how to work on these sides of the personality and the temperament of those who take decisions, and to know why it's important to invest in children and to do this kind of work. Over.
Yeah, over. So like if I was meeting with Anthony, for example, and I was giving examples, I'll find ways of bringing soccer in it because I know Anthony loves Anthony loves soccer, and we bond on soccer. So some of the analogies I will use will be something that, and so I will find a way of creating that likeness. So that personality is really powerful. Like if I go in Ghana and sometimes I don't even speak the local language, the training goes very different versus when I do. Um, so Raul, in terms of the content, I think if there is room one day, maybe sit down and then take each of the frameworks. So immunity to change, for example, is a very powerful one that I could walk you through, and we can even apply it to ourselves and then see how that is kind of used. We could go through the Fox behavior model and how that one is being done. But today I just wanted to give you a big picture overview. And I'm glad you got the feeling piece because I wasn't sure how it would resonate, but I think it's important. So Sarah, maybe create when we have another workshop, maybe.
More work for you.
Oh yeah, in a good way. In a good way. Anything for Raul, I'll do it.
Kwame, I have two questions.
Yes, sir.
First of all, I have to thank you because your presentation was great. I agree with Raul. It gives us a lot of points that we can use that I feel are very useful for our work in EPIC project. So thank you. Just not to resolve it now, just to consider for the future, I have two things that I have difficulties to deal with. I had these difficulties for years. I couldn't find which one is the best answer. One deals with bureaucracy, public bureaucracies, and talking about two things. One is the culture of each bureaucracy, and the second is a matter of power. When we talk about intersectoral scope and actions and planning and management, etc., and we deal with decision makers, we have to consider that there is a fight among them in terms of who is going to be the sector that is going to coordinate, who's going to order the job oriented to children and their families and their communities. You know that it's a matter of power, and it's very classical to find that education wants to lead, or health wants to lead, or habitat wants to lead, etc. So that's one point. The second point is each sector has or suffers the problem of insufficient resource available. So they have restrictions.
Right.
Who is going to settle the priorities? Because each municipality as a whole, in our case, has different priorities, and each sector has their priorities. How to organize them in and agree in some way that it is clear which is going to be the first, which is going to be the second, and how to deal with that considering the different sectorial priorities. I want to raise that points which are very difficult to deal with and are present in, at least in all our reality we have to deal with. Thank you.
I think this one is above my pay grade. This one is really hard. And so maybe Anthony, I don't know, you have gazillion experience, maybe you could chime in. How do you deal with the power differences? Who gets to decide, who gets to lead? That's one. And each of the sectors, they have their own priorities and things like that. So how do you?
Yeah, I mean, it's what you know, as academics, we often forget that anybody working within a less free organization like a bureaucracy, these people are always juggling what to say, what they can commit to based on what their understanding of the hierarchy. I mean, I wouldn't like to be a civil servant in America right now because of those threats and stuff, but always, and there is certainly in the British civil service, there is always a tendency to do less and to be much more cautious, because it's easier to be cautious than to take a risk and then it go wrong. So there is always that kind of inertia, that sense of entropy within civil service. But you do get good people that want to make things happen. So it's about finding the right people. There's also a study that I'll refer you to, and I'm trying to, because Sarah might remember, the one done, it's done by Imran Rasul, R-A-S-U-L, who's an economist at UCL, very smart economist, with another guy whose name has just escaped me. And they published it. It was all about the civil service in Nigeria and and they compared different strategies for making the Nigerian civil service more flexible. And basically what it said was that if you gave a task that was devolved to a group of civil servants and asked them to get on with it as a group, it was much more effective than if you just sort of gave an edict and told people what to do. Within a group of like-minded colleagues, they felt more creative and able to move because they weren't going to be blamed for anything on their own. But there's a paper, I think they put it in an economics journal. I'll try and dig it out for you. Sarah, do you remember that?
Yes.
Daniel something, Daniel Rigg, was it? Or Daniel?
We can find it. I'll use this opportunity also just to mention another paper that came out recently, a realist review of power dynamics and intersectoral collaboration. I'll put right here in the chat. Oops, hold on, I sent it. And what they said, just looking at the abstract, they found a couple of different things, and I won't summarize it all here, but that inclusive policy development processes mitigate power asymmetries, but that you need facilitation to try to make sure that they don't disrupt and throw things off course. Equitable resource allocation, leadership commitment, and shared goal alignment. I think you might be interested in looking at the paper because it looks specifically at intersectoral policy processes and power dynamics within those. Another thing I was thinking of asking Kwame to briefly describe was, Kwame, the way you mapped mandates. Because I think that when people understand that it's already their job to work for children, it can bring people together. Could you just maybe say a word or two about that, Kwame?
Yeah, and I think that I couldn't spend time on that one, and I think maybe probably in my answer some of the priority ones. So when we go to the municipality or district, we try to find either a document or a strategy that the municipality has that maybe has some bit of intersectorial nature to it. And then we map out what are the policies that are inside of it, what are the activities that are inside of it, and then what are the gaps that are in those activities, particularly as it relates to our work. So when we started with ours in CAP 2030, Ghana had about almost 22 different ministries. So the government required them to have a medium-term strategic plan. Carlos, I don't know if I should pause for you to translate, but let me know. So we looked at that plan for each of the different sectors, and we tried to find out, okay, are they doing anything in relation to children at all? So that was the first one. And then if they're doing something for children, what exactly are they doing for children? What are the activities are they doing for children? And then what are the key gaps? And then we categorize them in those who are not doing anything for children, and those who are doing some for children, and those who are doing everything for children. And then that became the basis for conversation. And whenever you do that, I think they like it so much because it's able to kind of map onto what they are doing currently and then what is missing in what they are doing. And then you can make the argument that if you were to focus on this or your mandate is aligned with children, then it begins to quite work well when we do the document reviews, for example.
No sé si alguno de nuestros colegas que habla español quiere aventarse a hacer una traducción, porque hubo momentos en los que entré y salí y de repente me di cuenta que no seguí todo. Hubo. No hay nadie que pueda hacer una traducción. Una disculpa, Kwame. Mira, yo tengo un problema de deficiencia de la atención. I have a problem of attention deficit disorder. So I'm constantly in and out, in and out. So unless you tell me at the beginning, Carlos, translate this, I struggle to
then you're
follow.
out. So
I'm
so
constantly going in and out, and then it's like, so sorry. What were you saying?
Okay, so
I'm
what I
very
said,
sorry about that.
we could start with the sector itself. Maybe their plan or their strategic plan that they want to have. And then you analyze it to find out whether they are doing anything for children. And if they're doing something for children, what exactly are they doing? And then how does your project fit in or doesn't fit in, depending on that. So we try and find a plan or something that is central.
Ok, entonces lo que Kwame está comentando es que normalmente empiezas tratando de hacer un mapeo. En este mapeo estás tratando de ver qué es lo que están haciendo en relación a un tema en los diferentes sectores, con la idea de que estás tratando de entender qué es cada uno de lo que los sectores está haciendo en relación al tema de interés común. Go ahead, Kwame.
I think that's about it. Sarah, does that suffice? Okay, good.
Carlos, did you have something you wanted to say?
Yeah, sorry about that. I was also thinking of my comment. So sorry about that. So one of the things that I wanted to kind of build on what Anthony mentioned, because a lot of the times it's not sometimes just giving them a task, but giving them a task that is outside of of the way institutions tend to see the problem. And I'm going to try to do this also, the translation in Spanish. But I want to give a little anecdote here. I was once tasked in Mexico to go and give a master's degree kind of course for the Ministry of Agriculture about food security and malnutrition. So I went there and then, I just did a very simple academic kind of like putting together food security and malnutrition and linking all the different studies that had been linking at both of them. And one of the responses that I got from the people taking the course of the Ministry of Agriculture, and all of them had like some of them PhDs and master's degrees, they were all very surprised and very kind of like in awe. How did I manage to make all these linkages between food security and malnutrition? Because they didn't think they were linked. So for me, I was shocked. It was, hold on a second, for me, it's more like I want you to answer more like, how do you manage to disconnect them? Because these are, connected at the umbilical cord. And what they said to me is that when we're talking about malnutrition, this has to do with the Ministry of Health. All the indicators have to do with the Ministry of Health, and therefore we don't deal with that. So it's not in their purview. They are just looking at indicators of food security. And I feel like when you are talking, for instance, if sometimes the trainings that I have done focus on malnutrition, I notice that, and I get sometimes those intersectoral trainings, I know that unless the Ministry of Health is involved, these are the ones that are going to be following the discussion, and all of the other ministries are going to disconnect because it does not fall under the usual indicators purview. So sometimes thinking of a task that is beyond what the institution is seeing might help create that unity. Y rápido así para traducir en español, porque veo que la traducción que se hizo aquí no está tan mal, es de que muchas veces la forma en la que los sistemas, los sectores están fragmentados es a través de los indicadores. Entonces yo una vez hice un entrenamiento de maestría en la Ciudad de México con el ministro de Agricultura, con relación a salud, seguridad alimentaria y malnutrición. Y los que atendieron el curso estaban sorprendidos de que habían de que habían enlaces muy pertinentes entre la seguridad alimentaria y la malnutrición. Y me agradecieron mucho que por primera vez habían entendido que había relación entre la seguridad alimentaria y la malnutrición. A lo cual yo les exclamé, bueno, pero es que la seguridad alimentaria y la malnutrición ahora sí que están unidas desde el inicio, ¿no? Entonces, ¿cómo es que ustedes lo están separando? Y a lo que ellos me respondieron fue de que, bueno, es que los indicadores de seguridad alimentaria son parte del Ministerio de Agricultura y los indicadores de malnutrición son parte del Ministerio de Salud. Y como ninguno de los dos, pues ahora sí que son entidades diferentes, pues no comparten y no ven las ligas entre los diferentes indicadores, ¿no? Entonces, creo que aquí muchas veces es tratar de irnos más allá de los términos y de las narrativas que son parte del sector y tratar de entrar a un nivel más alto en el cual los dos sectores puedan entenderlo. Over.
Thanks, Carlos. Kwame, we have 2 minutes left on our seminar. I think we should probably close on time. Do you have any closing words as we finish up?
You have 30 minutes.
It's that hopefully there's another 2.0 where we can delve deeper. That's what I'll say. Thank you so much for coming and thank you for always being a good audience.
Thank you.
Thank you, Kwame. I know we all really learned a lot. Are you able to share the slides that you... Fantastic. So maybe you can share that and the immunity to change article, and I will share the power dynamics and intersectoral collaboration article. And if anyone else has anything to share or say, we can do it via email. Yeah, thank you so much, Kwame, for the time you took to prepare. Gracias a todos. Y lo siento para los problemas de traducción, and sorry I don't speak Spanish, but thank you to everyone and have a great morning or afternoon.
Thank you. Bye. Thank you. Thank you.
Bye.
Bye. Thank you.
Bye-bye.
Bye.
Well done, Kwame.
Oops.
Bye.
I can't get out either.